I was so desperate. I had no place else to go. I had no food. I had no one to talk to.
Well, I was desperate with my diabetes, my chronic back pain. I had no place to go.
I found out that I was pregnant and didn't have insurance at the time.
Mom's had dementia for several years, but it was getting worse. I just couldn't stand seeing her sitting at home alone, staring at the television set. So I was desperate and looking for a place for Mom to go.
No one should go without health care. No one. Yet every day, thousands of ordinary folks, through no fault of their own, fall through the cracks. They can't afford medical care, while politicians and corporations are still trying to figure out how to solve the problem. Some dedicated healthcare professionals right here in the East Bay have been doing something about it for over 30 years. They're called Lifelong Medical Care. And here's how they are making a difference.
When I come to Lifelong, I feel good knowing that all my medical needs are going to be met.
Lifelong Medical is like a family connected with my family.
I feel respected.
If it wasn't for Lifelong, I would have died.
Lifelong Medical Care was founded by the Gray Panthers in 1976. Nowadays, we have 9 different sites that we operate. We serve a range of patients. They start in age from babies and pregnant moms all the way through very old people. We serve about 22,000 people per year. We offer primary medical care, dental care, mental health services, adult day health care for disabled older people. Our dental services goes from kids care all the way through elderly care and dentures. Many of our patients at Lifelong, like Gwen and her family, have very few options in terms of getting health care.
I've been coming to Lifelong for over 9 years now. So it's myself, my husband, my youngest daughter, my granddaughter, and my aunt. My mother-in-law and my aunt goes over to over 60s, and everything that they want is right there. I have COPD, diabetes, high blood pressure. I suffer from high cholesterol. I'm on oxygen therapy.
I hadn't seen a doctor in maybe 10, 15 years, so I was really glad to get in here.
Gwen and Bruce have been my patient for 6 or 7 years. Both of them have undergone really pretty significant medical crises since they've been my patients. For Bruce, it was life-threatening pericarditis, where his heart almost stopped beating.
Dr. Gordon, Dr. Amy Gordon. When I go in and I see her, we talk about everything. She breaks it down to me where I understand what's going on.
We have a health education self-management program and a health ed counselor who meets with them.
My diabetes is managed, my blood pressure is managed, just the weight problem, that's all I have.
We don't just treat adults with chronic medical issues, but we get to see moms and babies too.
Last year I got pregnant. That's when Dr. Gordon stepped into my life. Last year I used the pregnancy group. Now I do the parenting group with my little baby. She's 9 months.
And hopefully get that baby Justice off to the best start possible in her little life. Everywhere I go in Berkeley, I see my patients. In the schools, in the supermarket. We all live together in this city and we all impact each other. So I think it's really important to take care of the health of all our community. The safety net is just spread incredibly thin, and I would be seriously worried, especially for Gwen, for her health if we were not here.
When our community, when our donors help Lifelong, they really help us provide care to families like Gwen's and to babies like Justice, and make sure that every family has a good, healthy start, and that makes our whole community stronger. That's the difference that people who help us make for us at Lifelong.
Once, these folks were alone and afraid. Thanks to Lifelong, they now have a place to go, to belong, to be treated with care and respect, so they can get on with making the most of their lives. We're on location at Lifelong's West Berkeley family practice. In this small space, built in 1928, dedicated staff see more than 2,000 patients every month, double the number seen here 8 years ago. In response to the growing need for medical care, this historic building is undergoing renovation, preserving its unique architecture while expanding the number of examination rooms and treatment areas. Lifelong is partially funded by government agencies, but it depends largely on the generosity of the community. Please help Lifelong if you can. A lot of people are depending on us.
From the very beginning, I was like, I'm so glad that this place is there.
It works. There's a lot of places that don't work. Something about it here is it's working.
I love the whole staff at Lifelong.
To me, Lifelong was a lifesaver for our family.
They saved my life. I don't know how else to say it. They just saved my life.